Hey class, today we're going to continue with talking about the gross anatomy of the muscular system. In the last lesson we talked about muscles of the head and neck, and today we're going to focus on the thorax region and our upper arms. So first we're going to focus on the thorax or trunk muscles. These are muscles that move the vertebral column. There also include muscles of the anterior thorax, which is the front of your body, and muscles of the abdominal wall. Just like I did with the head and neck muscles, we also have included these little snippets from your textbook that we use to kind of show the name of the muscles along with the origin. Again, remember your origin is your immovable or less movable joint or bone. And then your insertion, which is your movable part. And then the primary action of each of these muscles. Again, here is another little thing. This is from the posterior muscles that we see within the thorax region and our upper arms. Okay, and our last one. I've also again re-included this picture in case you guys need it. It includes both the arms and the thorax and the abdomen region. And again, here is a posterior view. Now let's get into talking about the muscles. We're going to first talk about your anterior muscles of your trunk. Remember, anterior means the front. So these are all muscles, if you're looking at the front of the body, we can see. The first one is your pectoralis major muscle. This is a large fan-shaped muscle covering the upper part of the chest, and the whole point of this is to adduct, ADD, and flex the arm. Remember, adduction means to bring that body closer to the midline. Again, flex means to make that angle between two pieces of bone smaller. When we look at a picture of this is your pectoralis major muscle. Again, major point is to help pull the arm down or adduct the arm or flex it. The next major one we're going to look at, but we don't actually see on a picture, is something called intercostal muscles. These are deep muscles, so we do not see them on the pictures that I showed you on the previous slide. They are found between the ribs, and this is a very important muscle for breathing, and it helps raise and lower the rib cage. So again, we will not see it on this picture. Next, we're going to focus on posterior muscles of our trunk. The two on this slide are your trapezius and latissimus dorsi. Your trapezius is your most superficial muscle on the posterior neck and upper trunk, and remember, posterior means back. These are seen together, they form a diamond, and so that's usually what gives them up. They extend the head, or in other words, they help lift up your head. They help elevate, depress, adduct, and stabilize your scapula. So they're very important for your scapula in order to maintain certain postures. The next one is your latissimus dorsi. These is two very large flat muscles that cover a majority of your back, and they put up here your lower back. The whole point of your latissimus dorsi is to extend and adduct the humerus. This is also very important muscles when the arm is brought down in a power stroke whenever you're swimming. So if we think about these two muscles that we talked about, again here we have the trapezius. This forms a diamond shaped. I know it's kind of brought out over here, but usually there's a matching one on the other side. And then the one that we talked about over here is your latissimus dorsi. Again, it covers a majority of your lower back. It's a huge muscle. We're going to use that whenever we have that swimmer stroke. The next couple that we're going to focus on are your recti spinae and your deltoid and your quadratus lumborum. So your recti spinae, this is also considered a deep muscle, and so on the previous picture we took away some tissue, and so I'll point that out. It spans the entire length of your vertebral column, and hence the name spinae. It's going to be near your spine. It is a very powerful back extender. Again, it's very powerful in making sure that when you lift your upper body up and stand straight, it makes sure that it's straight. It also provides resistance that helps control action whenever you bend over at the waist, except for apparently I can't spell the right type of waist. So the next one is your deltoid. This is a fleshy triangular shaped muscle that forms the rounded part of our shoulder. So whenever you feel the upper part of our shoulder, that is our deltoid. When we were learning the body regions, that was known as the deltoid region. This is a prime mover of arm abduction, ABD, and that means it's going to pull your arm away from the midline of your body or pull your arm up, like if you were raising your arms at an airport. The last one is your quadratus lumborum. This flexes your spine laterally. So again, it allows you to kind of turn your spine to look behind you. And it also helps extend this lumbar spine that we see. So if we, I gotta go back to the previous. Here we're gonna show the big deltoid muscle that I was talking about. This is again a triangular muscle. This picture is showing this is a site for intramuscular injections often. This is where you get a majority of your shots, like a flu shot. And then here we took away all the superficial muscles to kind of show some of the deep muscles that are not necessarily seen on the surface. And those two that we talked about were erector spinae. Again, we're going to notice that it covers the entire length of your spine. It's formed from 3 different muscles. And then your quadratus lumborum, this is right here. Again, you're going to notice that yes, it's attached up here, but it also attaches to the top side of your hip bone that we see. Next, we're going to focus on muscles of the abdominal girdle. So now we don't have so much the trunk and the back, more of the abdominal, your stomach area. This forms a natural girdle that reinforces the body's trunk, and it helps contain and protect those abdominal contents because these ones are not necessarily covered with bone for protection. So muscles do allow some form. The first 2 are your rectus abdominis and then your external oblique. We'll then talk about your internal oblique and a couple other abdominal muscles. So for your rectus abdominis, this is actually your most powerful muscle of your abdomen. It runs all the way from your pubis to your rib cage, and it helps flex the vertebral column. In other words, if you were to bend over, it helps stabilize that. It also helps compress any abdominal contents during defecation. And you guys probably, hopefully know what this is, but if not, defecation is when you guys poop. It also helps compress your stomach or your abdominal cavity whenever you are trying to push during childbirth. The second one is your external oblique. These are fibers that run downward and medially. Oblique usually means at an angle, so they're going to move at an angle. This angle that it forms is from the last 8 ribs, and they insert into the ilium, which is the upper part of your hip bone. This again helps flex the vertebral column, in other words, helps when you bend over, and it helps rotate the trunk, so for example, looking behind you, and helps bends it laterally, so to the side. I'm going to show you those 2 first. Again, we have rectus abdominis. This is going to run up and down. Again, defecation and childbirth. And then we have our external oblique, I think we talked about. So again, we're going to see it run sideways. The next 2 are internal oblique, which actually is just deeper to your external obliques, and they run just at right angles. So still diagonal, but opposite way. And these arise from the iliac crest of the hips and inserts into the last 3 ribs, and their function is exactly what the external obliques are. They help flex the vertebral column, so it allows you to bend over. It rotates the trunk, so in order to look over behind you, and it helps bend it laterally, so if you were to lean side to side. And then we have the transverse abdominis, and this is actually the deepest muscle of the abdominal wall. Transverse just means horizontal, so these fibers run horizontally, and they also help function to compress abdominal contents as well. So if we look at it, our transverse abdominis, we see the fibers kind of run left to right. We see this little cutout because they do run deeper. And then our internal oblique, notice that the fibers, if my external oblique run this way, my internal oblique run this way, and they form that perpendicular that we see. Oops. Now that we've covered the trunk, the last part that we're going to cover is muscles of your upper limbs that we see. Usually we're going to first talk about anterior and then we're going to talk about posterior. But one thing to note is that anterior muscles cause you to flex or decrease the angle between two bones, while posterior muscles tend to extend the arm and increase the angle between two bones. So first we're going to talk about a couple that we see on the anterior side. That is your biceps brachii, which is probably your most familiar muscle that most people know. This helps flex the elbow. It is a prime mover for flexing, and it acts to supinate the forearm. So if we remember our action of supinate, it means kind of take your thumb and turn over your hand so your thumb is lateral to your body. The next one is your brachialis muscle. This is deep to the biceps, and it also helps with elbow flexing, and it helps lift your ulna. And if we remember, our ulna is our major bone in our forearm that connects with our pinky. Oops. So let's find a picture of that and then we'll go back. So here is your biceps brachii. Again, it's a huge muscle that we see bulged here. And brachialis we're going to see on either side that helps flex the arm as well. The next one we're going to talk about is your triceps brachii. This is actually the only muscle that we see really fleshed out on the posterior side of your humerus. And because it is on the posterior side, this is going to do the opposites of your biceps. This is actually going to be a very important prime mover in elbow extension. And it allows you to deliver a very strong hit or jab whenever you're boxing or hitting something. The next one is your brachioradialis. Brachio just means it attaches at your arm. Radius, it also helps attach at your radius in your forearm. This is actually a fairly weak muscle. Again, it arises in your humerus or your brachia region, and it resides mainly in your forearm. That's where we get the radialis part of this name. So if we look at this, here is your brachioradialis. It attaches up here in your humerus, but again, you notice a big chunk of the muscle does reside over here near your thumb or your radius bone. Then we talk about your triceps. It's not labeled in this picture, but right here, this little bulge we see on either side of your biceps, that is your triceps from the anterior view. If we were trying to see what your triceps are from the posterior view, again, it's this large fleshy muscle that we see over here. And the last two that we're going to talk about has to do with moving your fingers. We are going to group them together because it's just a lot easier for you guys when you're learning. We have your flexor carpi and flexor digitorum. And if you think of carpi, it means your wrist, and digitorum means your digits. And since they flex, these are going to be found on the anterior part of your forearm, and exactly what the name suggests, they help flex or bend at the wrist and bend your fingers. The last one is extensor carpi and extensor digitorum. These are going to be found on the lateral and posterior side of your forearm. This is going to, just like the name suggests, extend your wrist and extend your, cannot spell on this one, fingers. So it's not necessarily shown in any of these pictures, but whenever you guys label them, again, flexing is going to be on the anterior picture, extending is going to be on the posterior part of your picture on your wrist and lower forearm region. And that is the end of today's lesson. If you have any questions, please make sure you ask, and I hope you guys have a great day.